1 out of every 5 Americans will get melanoma at some point in their lives. This means that 1 of you will develop skin cancer. Look at the person next to you. Look in the mirror. Is one of these people going to be you? Not protecting yourself from the sun can make you at risk for premature aging, eye damage, and skin cancer. Today, I want to encourage you to pay attention to the sun's damaging effects and believe that this can and will affect you. This topic is useful to all of you because you do not wear sunblock daily, you don't get annual skin exams, and some of you are still using tanning beds. You may think right now, the sun does not affect me. I don't have to worry about its effects until later in life. This is not true. The sun has already damaged your skin and will continue to do so unless you do something about it. Through my experience of working in a surgical oncology office and my research, I will tell you that you are never too old or young to protect yourself from the sun's damaging rays. Not protecting yourself from the sun on a daily basis has harmful effects on aging and can even be deadly. Just like your skull protects your brain, the skin is your protectant from heat, injury, infection, and regulates temperature. Yet we do not take care of our skin when it does all of this for us. Have you begun to see wrinkles? Maybe your skin is drier, or maybe you're even seeing sunspots. If you see any of these, you are seeing damage from the sun. According to the United States Environmental Protection Agency, 90% of the visible skin changes commonly attributed to aging are caused by the sun. The effects of aging on the skin are not immediate, but show up over a period of time. So even though you cannot see these damages now, at some point you will. The slide shown here shows how a woman's skin has changed over the period of time due to the sun's effects. Maybe you wouldn't care so much about the wrinkles and brown spots because you couldn't see them. Just like the skin, the eyes are at risk for sunburn and sun damage. According to the American Cancer Society, you can develop non-cancerous growths that block vision and can even cause cancer of the eye. Primary eye cancer can occur at any age, and your risk increase as you get older. Sun damage over time can also lead to cataracts, which is clouding of the lenses. If you develop cataracts, you will need to get bifocal glasses or possibly have surgery to correct this. This is a picture that shows what normal vision should look like and what vision through a cataract would look like. If premature aging and eye damage isn't enough to change your mind, maybe the word cancer will. According to the Skin Cancer Foundation, it is estimated that 790,000 men and women will die from melanoma annually. Skin changes for melanoma start at a very young age. The first sunburn that you get changes the way that your skin produces melanin, the pigment in your skin. The tan color you develop when exposed to the sun is actually just damage that you've done to the top layer of your skin, the epidermis. Risk factors for skin cancer are severe sunburns, tanning, and sun exposure. Although melanoma is the most deadly type of skin cancer, there are also other types. These types include basal cell carcinoma, squamous cell carcinoma, and actinic keratosis, which is premalignant. Think you're too young? According to the Environmental Protection Agency, the most common cancer among the ages of 15 to 29 years old is melanoma. The most common treatment for melanoma is surgery to remove the area. This surgery can leave you with large defects within the skin, and sometimes a plastic surgeon will need to repair it. If melanoma is not removed soon enough or it is invasive, it can spread to other parts of your body, including the lymph nodes, liver, lung, and bones. Once you have developed melanoma, you must be followed by a dermatologist for 14 years to check for reoccurrences and new areas. Picture yourself with all this effects the sun has to offer. Do you want them? If you want to stay youthful and lower your risk of developing skin cancer or eye damage, you must protect yourself. Unfortunately, you cannot undo the damage you have already done to your skin, but you can start preventing yourself from further damage. Remember, not believing that you are old enough to be effective is not true, and the sun is harmful at any age. I ask you to go to the Centers for Disease Control and Prevention for more information about what you can do to protect yourself from these harmful effects. There is also a phone number listed here if you do not have internet access. Knowledge is power. Do not fall victim to being vulnerable or naive. This is going to affect you. You need to take action now. Do not let this happen to you.